Stock patient script title standard clinical encounter with a stock patient takes place in a doctor's office exam room or telemedicine setup, with one middle-aged adult patient presenting with mild chest tightness or abdominal discomfort. The camera slowly zooms in as the patient sits on a chair or exam table. They shift slightly, adjust their clothing, breathe slowly, and register subtle unease while maintaining composure. The patient begins explaining ongoing intermittent chest pressure over the last few days, frequently triggered by meals or exertion paired with increased fatigue, yet reports no tobacco use, minimal alcohol engagement, and exercise, and no worsening systemic symptoms. When asked about symptoms, they state absence of fever, nausea, vomiting, diarrhea, or respiratory complaints. Rate their chest tightness as low on a 10-point pain scale, and display engagement readiness, and a few gentle throat clears during a silent physical exam. They raise an arm for a blood pressure reading. Breathe deeply upon request, respond to palpation, touches of the chest and abdomen, open their mouth on cue, and follow a visual tracking test, showing cooperation, and slight discomfort. The focus shifts inward as the patient reflects on recent stress at work, poor sleep episodes, or racing heart, or sweating at night, leading to a cautious decision to seek assessment. Their conversational tone alternates between mild concern, reassurance, and curiosity. They ask whether it could be serious, express appreciation for the time spent, and ask about how changing their diet or exercise habits might help. Their body language shifts from crossed arms and downward glances to steady gaze and calm nods in a silent B-roll segment. They explore a pamphlet sip water glance toward their phone and shift position. Naturally, the flow moves into wrap-up as they affirm willingness to proceed with recommended tests. Ask when a provider should be contacted if symptoms worsen, appreciate the clear explanation, and confirm a plan to follow up next week before standing, nodding in agreement, and exiting the frame calmly. The suspected cause is explained as a combination of mild gastroesophageal reflux anxiety and possible early cardiovascular strain or hypertension, driving a layered treatment plan. The provider describes multiple options, beginning with lifestyle adjustments like reducing spicy or acidic foods, timing meals earlier, avoiding late caffeine, light low-intensity movement, stress reduction exercises, and relaxation techniques. The patient may also trial over-the-counter antacids, H2 blockers, or proton pump inhibitors. If cardiac risk factors become evident, discussion of low-dose beta blockers, blood pressure medicine, or referral for further cardiovascular assessment, such as ECG, stress test, or echocardiography, is introduced. Persistent or atypical symptoms prompt consideration of upper GI evaluation, including endoscopy or gastroenterology. Consult several treatment tracks are offered, allowing adaptation from conservative interventions to pharmacologic management and specialist care. The patient resumes a quiet seated position, appearing thoughtful, then gradually relax, briefly smiles, glances at their phone or clock, and exits the scene with a soft fade out.